Alrighty, folks, welcome to another edition of The Healthy Way right here in Love 101 FM, the family station. Now, today we're talking about myths versus facts. And with us this morning is Dr. Leo Walker. He's an obstetrician and gynecologist from the Westminster Medical Center. Hey, Dr. Walker, how are you? Welcome.
Hi, thanks. I'm great. How are you?
Good, thank you. Good.
Nice.
And we're also giving them some did you know, right? So we're mixing things up this morning. So the first one, to improve chances of pregnancy, couples should have sex every day while ovulating. Is that a myth or a fact, Dr. Walker?
Well, that's actually a myth. What's recommended is that at least 1 to 2 days prior to the time of ovulation. That is really when couples want to try and have intercourse. And this is really because semen or sperm is able to survive in the vaginal canal for up to 5 days. So that means that right around the time of ovulation, that sperm should be making it right up the fallopian tubes to fertilize that egg. So it's really that 1 to 2 days prior to ovulation that you really want to mark as the time to have intercourse.
So that's a myth. All right. Smoking is a cause of male infertility. Myth or fact?
That's an absolute fact. So smoking has been shown to reduce the quality as well as the quantity of sperm.
Right.
We also have studies that show that mothers who smoke while pregnant, male offspring often grow up having a reduced sperm count. So men who smoke or who are exposed to cigarettes or marijuana smoke have a reduced volume and a reduced quality of sperm. But also male fetuses who are exposed to cigarette smoke while in utero often grow up to have a reduced sperm count as well.
Okay. HPV warts can only be surgically removed. Myth or fact?
Oh, that's actually a myth. So we have both medical and surgical means of removing HPV warts. We often have topical agents that we can apply to the warts, but these are usually limited to smaller warts and usually a small number as well. Therefore, individuals with very large warts or a large number of warts often will require some form of surgical removal. However, they do have topical agents which can be applied to smaller warts and fewer warts.
Okay. Did you know sexual activity is a risk factor for bacterial vaginosis?
But that definitely is true. Sexual activity is a potential risk factor for BV. As a matter of fact, there are studies that show that individuals who have multiple sexual partners have an increased risk of bacterial vaginosis, as well as the use of barrier contraceptives such as condoms results in a reduced incidence of bacterial vaginosis. So there's a direct link between sexual intercourse and bacterial vaginosis, despite it not being a sexually transmitted infection. And this is primarily because there is no male counterpart of bacterial vaginosis. It only exists in females, and it occurs primarily as a result of a change in the pH of the vagina.
All right. Another did you know the vagina changes in many ways after childbirth?
Absolutely. And any woman who has given birth can certainly attest to that fact. And it's primarily due to some of the hormonal changes which occur following delivery as well as breastfeeding. Now, following the delivery, the levels of hormones, primarily estrogen, drop significantly. And estrogen plays a crucial role in terms of maintaining some of these environments in the vagina. One, the lubrication of the vagina, the tone of the vaginal skin or epithelium. So following delivery, a lot of women will experience a lot of dryness to the vagina, a lot of soreness to the vagina. Of course, there may be significant bruising, especially if it was a traumatic vaginal delivery. But particularly in women who breastfeed, breastfeeding stimulates the release of a hormone called prolactin, which helps the body to produce more breast milk. Now, unfortunately, one of the other side effects of prolactin is that it decreases circulating estrogen. So it is not unusual for new mothers particularly those who are breastfeeding, they experience a lot of dryness and soreness of the vagina and even a lot of discomfort during intercourse following delivery.
Got you. Got you. Myth or fact, menopausal symptoms can start as early as age 30.
Yes, this is absolutely true. So for women who have what we refer to as primary ovarian insufficiency,
Mhm.
what was previously referred to as premature menopause, can start to experience menopausal-like symptoms at that age.
Mhm.
So the same symptoms that women experience in menopause at around age 50 to 51,
Right.
these women can start to experience up to 20 years earlier. So they can experience the hot flashes, the mood swings, the vaginal dryness, the bony pains, the loss of short-term memory. All of these things can occur
Mhm.
in women who have primary ovarian insufficiency.
Mhm. All right. Another, did you know 75% of cases of pelvic organ prolapse is secondary to pregnancy and childbirth?
Absolutely. Again, if I always compare it to a ship that has come into dock,
Mhm.
it's floating on the water and it's held in place by anchors. Now, remove these anchors, the ship may still float, but if we lower that level of water, those anchors are going to have a very difficult time holding the ship in place. Now, the ship in this scenario will be the uterus, which is a pelvic organ. The anchors will be the ligaments attached to the uterus, and the body of water will be those muscles in the pelvis that help to support the uterus. During pregnancy and childbirth, those muscles have to stretch and they become a little more lax. And that allows out of those pelvic structures to actually descend a little bit further from their normal anatomical position. This is usually referred to as prolapse. Of course, with age, these muscles also become a little bit more lax,
Mhm.
and therefore you have the combination of both childbirth and age, which is contributing to an increased laxity of these pelvic muscles,
Mhm.
resulting in pelvic organ prolapse.
Mhm. And if a woman is experiencing this, what can be done to correct it?
Well, there are both conservative medical and surgical approaches. Conservative it would include things like diet and exercise to reduce the body mass index because obesity is a potential risk factor.
Mhm.
If a person is a smoker who want them to stop smoking because of chronic cough,
Mhm.
is also a potential risk factor for prolapse. For individuals who have constipation, we want them to eat more fiber, eat more fruits and vegetables, anything essentially which can increase the abdominal pressure
Mhm.
is a potential risk factor for prolapse. Right? But there's also medications which can be used or exercises which can be used to strengthen these muscles of the pelvic floor.
Mhm.
That's often referred to as the Kegel exercises, which help to strengthen those muscles to support those structures a little bit better.
Mhm.
There's also vaginal creams or estrogens, which have been shown to improve some of the symptoms secondary to prolapse. Majority of the cases of prolapse, I would say, though, in terms of long-term therapy, that is achieved through surgery, essentially suspending a lot of those prolapse structures or removing the structure that is currently being prolapsed. For example, if it's as a result of an enlarged uterus, then we'll often perform a hysterectomy to remove the uterus, essentially removing that prolapsed structure.
Mhm. I see some of my listeners online saying that's so true. Yeah, yeah. Let me do this one. This is the last one, out of time, regrettably.
All
Coffee
right.
increases your sex drive. Myth or fact?
Well, that is actually a fact.
Really?
There's actually some small studies which show that coffee is a potent vasodilator, meaning it causes blood vessels to dilate to increase blood flow to certain areas. Now, that also includes the genitalia. So it has been shown that individuals who drink more coffee have a heightened sex drive because of this increased blood flow to the genitalia. It's also been shown to improve erectile dysfunction in some individuals, again, because of that vasodilatory effect to the genitalia.
I said that's the last one, but this one is quite interesting, and I'm going to ask myth or fact. you know, interaction with semen and vaginal discharge increases the risk of BV. Is that a myth or a fact?
Can you repeat that one for me?
Interaction with semen and vaginal discharge increases the risk of BV.
Interact. I didn't hear the last part. You were chipping out a bit.
You heard me now?
Yeah, hearing you now.
Great. So interaction with semen and vaginal discharge increases the risk of BV.
Yeah, absolutely. So that's a fact.
Mhm.
So the truth is, semen is what we call basic if we had to put it on a pH scale, whereas the vaginal discharge is acidic.
Mhm.
So when semen and vaginal discharge come in contact with each other, it neutralizes the vaginal discharge. Neutralizing that vaginal discharge basically enables other organisms in the vagina to multiply. For example, the organism which causes bacterial vaginosis.
Mhm.
Now, even though this sounds like a problem, it's actually like that for a very specific design.
Oh.
In that the only way that sperm could pass through the vagina to get to the egg to fertilize it is if it has some mechanism of neutralizing that vaginal acidic pH.
Mhm.
So it's there for a purpose. However, it can occasionally cause bacterial vaginosis.
Mm. Mm.
That is actually quite true.
Right. Um. Right. Okay. How can you find again, my friend? Yeah. How can you
Okay,
find
so
you?
I am at the Westminster Medical Center. That's 1A Westminster Road off Eastwood Park Road. You can also find me on Instagram at Dr. Leo Walker and contact me at 876-372-3790.
Thank you. Appreciate it as always. Keep safe.
Definitely. Always a pleasure.
Great. Thank you. My brethren, Dr. Leo Walker. Yeah, obstetrician and gynecologist from the Westminster Medical Center. You're tuned to Love 101 FM, the family station, to catch you again tomorrow for another interesting feature inside the Healthy Way.